All right, everybody, welcome back. Hope you all had a great lunch and are energized for our session 4 and 5 this afternoon. So session 4 is going to be on measuring health risks in unmonitored regions. And because I just saw him walk in and he missed our words earlier today, Lawrence Friedel, I saw you walk in back there. If you can wave, there he is. Lawrence is the one who, the original HAQAST was his brainchild. And so, yes, so a round of applause. So he was the OG one to kick this all off. So we would not be here today without his work back a number of years ago, more than either me nor him want to mention probably at this point. But again, thanks for everybody for coming back. So our first talk is going to be, again, we're doing the tag teams between our HAQAST members and our stakeholders. Our first talk is going to be with Tracey Holloway, of course, our leader, and Katherine Pruitt of the American Lung Association. And I believe, Katherine, you're going to start off, so if you'll come up on stage. We will hand the microphone over to you, and the clicker is up here. Hopefully it's not as temperamental as it has been. So just the right button.
Okay. Is it on? Yes, it is. Hi, everybody. Let's see. Okay. Well, welcome back, everybody. I'm going to talk a little bit about how the American Lung Association has been thinking about using satellite data for health communications. Let's see. So in order to protect public health and to keep moving forward with cleaning up the air, the quality of the air we breathe, it's really important that the public know about the air in their communities and are able to understand it. But you all know that. I think that's probably why you do the work that you do. The American Lung Association takes our role as a trusted messenger about air quality and health to the public very seriously, which is one of the reasons we been continuing to think about ways to provide better information to the public. Since the year 2000, the Lung Association has been releasing the State of the Air report every April. And its longevity and credibility have made it a nationally respected resource that is quoted in the media every single day of the year. There are a couple of things about State of the Air that have contributed to its longevity. It puts the complex information about air quality into everyday language. It gives the public local information about the air quality in their county or their metro area. And as far as the media is concerned, they love that it gives grades to counties and to metro and ranks metropolitan areas for ozone and particle pollution. And it's based on quality assured, validated EPA data. The Lung Association is really proud of the work that we do in State of the Air and its ability to communicate with the public about air quality and what they've learned from us. But we know that there are a lot of people in this country that aren't served as well by the report as they would be if they could see themselves in it. The regulatory network, the network of regulatory monitors is absolutely the best source of credible, consistent, trusted data on air quality in the U.S., but it has its limitations. Only a third of the counties in the United States are included in State of the Air because they have sufficient air quality monitoring data. And we are not able to report the way we would like to on neighborhood level disparities in exposures. So the Lung Association was thinking about, well, can we look at alternate sources of data and emerging technologies to help us fill in some of those data gaps? When 5 years ago, Tracey Holloway got in touch with us and said, would you be interested in being a collaborative partner on HAQAST? Well, exploring the opportunities to use satellite data to fill in some of those gaps for State of the Air was a no-brainer for us. And we said yes, of course, even though we really had no idea how we might use what came out of HAQAST. Stop. So fast forward 5 years to this past fall when we released the first in our Something in the Air series of state-of-the-air supplemental reports. This report, we worked with the University of Wisconsin team who calculated 3-year averages for PM 2.5 for all counties in the United States, based on data that provided by the university, by Washington University, from which they could give us estimated annual design values for PM that were comparable to the design values that we get from EPA. And that way we were able to compare monitored counties and unmonitored counties side by side and start to identify areas of the country where levels of PM 2.5 in unmonitored counties might be sufficient to give us concern and need to take a closer look. Here are two of the maps that we include in the report. You can see on the left is the map of the design values for monitored counties sourced from EPA. On the right is the map of all of the entire nation, the estimated concentrations of PM 2.5 from satellite-derived data. A couple of things jump out at you. First of all, on the left, you can see that there are, in fact, a lot of unmonitored areas in the United States. And on the right, you can see that by the way, sorry, I meant to say that, remind you that the annual standard for PM 2.5, the new annual standard for PM 2.5 is 9 micrograms per cubic meter, which puts it sort of in that pale green area. So you can see that there are some, significant number of communities in that pale green and above that that look like they might have some PM 2.5 levels that will put the health of their residents at risk. In fact, we found in the report that 300 of the 2,700 counties, unmonitored counties in the U.S., had estimated PM 2.5 levels that would have achieved them a failing grade if they'd been included in the state of the air. So just to end with kind of a couple of the key messages, the takeaways from our report. First of all, unmonitored does not mean unpolluted. Using satellite data to reveal local hotspots in unmonitored areas can provide decision makers with useful insights for pollution control efforts. Researchers and air agencies should continue to work together as they have been to make progress on developing and disseminating data fusion products. The goal should be to continue refining and enhancing the use of satellite data to augment, not replace, the existing monitoring network. And we know that, and you know, certainly, that interest in satellite technology is not just about more data. It's about providing every community with the information they need to protect their health and to advocate for cleaner air. Thank you. I'll turn it over to Tracey.
Hi, everyone. Thank you, Katherine. It has been such a pleasure to work with the American Lung Association over the past 4 years through HAQAST. And I'm going to kind of jump off of our work together to tell you kind of an overview of some of the other work from my team that has been supported through HAQAST. And this is, of course, a team effort with great engagement by Jenny Bradford, who you all know, my colleague Monica Hartke, who does a lot of our data analysis and modeling, Pat Reddy, who's on our team supported by a rapid response project, Lizzie Kaisela, Summer Aker, Cara Scalfone, Olivia Goins, and Brad Pierce, who's one of my co-investigators and who led one of the Tiger teams that Barron mentioned earlier today. So across these projects, we work with a wide range of stakeholders and partners. I won't list everyone except to say that most of these participants are engaged through that rapid response project where we've been developing a Google Earth Engine toolbox to support exceptional event analysis. Katherine mentioned our work with the American Lung Association, and I think it's a really exciting example of how partner-engaged research can lead to new questions and new perspectives, because one of the things that I really appreciated working with the American Lung Association is they said, we're not interested in county average data, because, a number of us had already allocated data to a county geographical space. They said, we want to know something that would be more akin to a design value, which is the highest monitor in a county. And so then we started thinking about the highest grid in a county or the highest 90th percentile. And this has also then been so valuable to have Randall Martin's participation on HAQAST, because his group is really the world leader on developing these types of data products. And so to have on kind of speed dial Aaron and his team to make sure that we were getting the American Lung Association the right data at the right time and analyzing it in the right way. I'll just mention, one of our other partners going into this project who you've heard maybe less about, but has been the Rocky Mountain Institute. They were interested in whether satellite NO2 could provide an indicator of building heating on really cold days. And we did look into this, but found that it was impossible to parse out the impact of emissions versus with cold days, everybody cranking up their heater, versus the longer lifetime of NO2 on cold days. So actually this work has led to a follow-up project by my student Kara, who is the one keeping time with the time here, where she's developed a temperature-dependent bottom-up emission inventory for the national, in the context of the National Emission Inventory. So we're working on that project because this interesting satellite application question actually highlighted a broader issue in supporting air quality and winter conditions. A big theme of our work has been, as Dan Goldberg mentioned earlier, this trying to make column data for NO2 relevant to surface NO2 conditions. And Dan and I have built a few collaborations over the past few years, which has been really great. Monica Harkey has been using models to better understand the column to surface relationship characteristic of tempo. And then my student Summer Aker just has a paper that's in review at Atmospheric Chemistry and Physics Discussion, where we're now looking at the distribution of values. So not just do we capture the means, but are we capturing the peak values in both directions with satellite data relative to ground-based monitors? And can we use this to maybe identify areas that should have an NO2 monitor but don't? I mentioned that we have this toolbox that we've been developing, and my colleague Pat Reddy has a virtual flash talk on our HAQAST website. But it's been really exciting to see how Google Earth Engine can provide a flexible, powerful interface to support the technologically demanding analysis of smoke events for exceptional event demonstrations. So we really appreciate, we've gotten a lot of feedback from early adopters, and that is available as well. I'll end with to say that we've also gone beyond just health and air quality to kind of use a HAQAST approach to thinking about energy systems. And we've had a series of workshops. There's my colleague, Brad Pierce. We've been working with Paul Stackhouse at NASA Langley. And what's been exciting is to get engagement from energy companies as well, startup companies, BP, Alliant Energy. So I think that there's a lot of potential to keep moving in this direction around energy. Thank you.
Thank you, Tracey, and thank you, Katherine, as well, of course. So our next talk, and as Tracey kind of teed it up, and we also teed up the slides with this temperamental clicker, so be careful with it, is from our HAQAST member, Dr. Randall Martin. As Tracey said, a world leader in the development of PM 2.5 products, and also in ground monitoring station Spartan, which I know we'll hear about as well. And so very thankful that he's a member of the HAQAST team. And he will be joined by our stakeholder, Pallavi Pant of the Health Effects Institute in this talk. So come on up.
Thank you very much, John and Tracey, for those kind words. It's an honor to have been part of HAQAST over these years. And it's also an honor to contribute to those data sets that are used, such as the American Lung Association just described. I'd like to describe to you how these data sets are created. And so this is motivated by the immense health concerns associated with PM 2.5 that you've heard about from other speakers, as well as the large gaps in ground-based monitoring. And that motivates us to turn to alternative measures of PM 2.5 that leverage decades of innovation in probing the electromagnetic radiation emanating from the Earth and applying that information, those measurements, to deduce properties of atmospheric composition. And we'll build upon a number of instruments and algorithms you see listed in the bottom left for those NASA data that provide us with a columnar measure of optical measure of aerosol abundance, known as aerosol optical depth. And our next step is to relate that columnar optical measure to ground level PM 2.5 concentrations. And to that, we'll turn to a chemical transport model known as GeoSChem that divides the Earth's atmosphere up into hundreds of millions of boxes and solves for its chemical evolution during transport. You're seeing yellow for mineral dust, blue for sea spray, green for organics, black for black carbon, and red for the sulfate nitrate ammonium system. And given the role of the chemical composition of PM 2.5 in modulating the spatiotemporal relationship of aerosol optical depth with PM 2.5, we'll thus turn to this model for that information about that relationship. The next step is to evaluate and improve these algorithms. And to that end, we'll turn to a ground-based measurement network known as the Surface Particulate Matter Network, or Spartan, that John just kindly introduced, that leverages a ground-based measurement network known as AeroNet that measures aerosol optical depth from the ground, and in densely populated areas of relevance for health, adds an additional PM 2.5 monitor that measures both mass and composition, thus providing empirical measurements of that relationship between aerosol optical depth and PM 2.5. Our fourth step is to statistically fuse this geophysical data set with ground-based measurements from operational PM 2.5 monitors through a deep learning algorithm that employs the convolutional neural network to predict the bias between those geophysical data and the ground-based measurements, achieving the hybrid PM 2.5 data sets. An example of which is shown here for 2023 out of our 26-year record of these data sets. These data are striking. More than 90% of the world's population lives in regions that exceed the World Health Organization air quality guideline of 5 micrograms per cubic meter. And having a globally complete data set thus provides a valuable information source for a large number of international assessments that you see listed on the bottom. Within the United States, the data are also striking. It used to be that PM 2.5 was really highest in the east with lower concentrations in the west. But as you see in this data set for 2020 through 2022, that situation has reversed. It is driven by the increase in fire intensity and frequency in the west, some of what we've heard about from prior speakers, such as Jeff Pierce. And again, now leading to exceedances of the US standard, as we just heard about from Katherine Pruitt. It's also an honor to work with a variety of epidemiologists to explore the associations of PM 2.5 with a range of health endpoints, going well beyond cardiovascular and respiratory disease, but recognizing the systemic inflammation response associated with this PM 2.5 exposure that leads to manifestation of a variety of other disease endpoints. So with that, I'd like to recognize then the growing utility of the satellite-derived PM 2.5 data. Thank you for your attention, and turn the microphone over to Pallavi Pant, who will tell you more about applications of these data.
I would like to start by just thanking the HAQAST team for allowing the Health Effects Institute that I'm representing to be a part of this program as a stakeholder. We've really benefited from a lot of data products that you've heard about throughout the day today and that have been undertaken over the last few years. The piece that I'm going to focus on a little bit more right now is how some of these data sets, especially work that Randall just presented and also work that you heard about earlier today from Susan and Dan, is being used to understand trends in air pollution in places where the problem is really severe, but the data often don't exist. And similar to, the many versions of the map we've seen for the US and where the monitoring stations are versus not, if we look at the global scale and try and map out where there are reference grade air quality monitoring stations, this is a representation primarily for PM 2.5 monitors from OpenAQ, we very quickly begin to see the huge gaps that exist in some of the most populous places on the planet, including large parts of Asia, large parts of Africa, as well as many parts of Latin America. So these are places where we do know that the air pollution problem exists. We do know the health impacts tend to be very high, but we don't always have the ground monitoring data to rely on for decision making. And in that context, the availability of data sets such as the one produced by Randall, and that hopefully I will be able to switch to, there we go, give us an opportunity to get a sense of what the pollution levels are, how they're changing over time, and how we can use some of these data to inform and motivate action at different scales in many countries and regions around the world. So essentially, realizing that we can look at the spatial variability in a particular country across a particular region and also temporally begin to answer questions like, is the air quality improving in a particular country, in a particular region over time? What can we see and what can we say about changes that may have happened over the last decade or more? Are there also specific hotspots that we are less aware of? Dan showed earlier today the high NO2 levels in some of the cities in the Middle East as well as in Russia. And that information for a lot of people working on air quality would be very novel and hard to find were it not for these types of data sets. We are also able to, place more information in the hands of the policymakers because we can compare some of these larger data sets to say, are cities and countries meeting their national air quality standards, some of the international health-based guidelines or not? And also, ultimately, a really critical question, what are the health impacts of all of these exposures in all of these different places? I'm really glad to be following after Katherine Pruitt from the American Lung Association, because the State of Air report has been a motivation for the Health Effects Institute to publish the State of Global Air report, which we've done now for several years, and which really relies on the satellite-based data sets produced by Randall, but also by Susan and others, and supported by NASA. So that's wonderful. But there is another really interesting and important application. In the same places where we know there isn't a lot of air quality data, we also have significant gaps in the availability of association of air pollution and health outcomes, or epidemiology studies. And I want to give you one example from one region within Africa, so the eastern part of the continent. Over the last year or so, we've been mapping the available evidence on health effects of air pollution. And interestingly, what we find is that of the 34 papers that met our criteria, we saw 24 that were published just in the last 4 years during our search. And as many as 11 of those 34 papers in that region are based on satellite-derived estimates, allowing us to study health outcomes like anemia in children, cognitive development, and other outcomes like pregnancy loss in a region with very limited air quality data and very limited health evidence, creating strong motivation for action in those cities and in those places. I could go on and on about other examples where this data has been particularly valuable, including in South Asia, where you can see air pollution continues to be a big problem, and the data sets have been used to map where the brick kilns are, where burning is happening. So really, again, thank you to the HAQAST team for making all of this work available to us so we can continue to use it for practical applications. And I'll pass it back to John.
Thank you so much. Right, moving to the next talk, and again, we're planning on, I believe, bringing everybody up like the last session for Q&A at the end of this session, so hold on to your questions. Our next talks are going to be by Amber Soja of NASA Langley Research Center and Sherri Hunt of US EPA. Amber, I said Daniel was the dust guru. I'm going to bless you as the fire guru. And Amber has, of course, been with us for many years, is now at NASA Langley Research Center, came to us originally from the National Institute for, let me make sure, National Institute for Aerospace. Yes, I got that right. And so I just want to say we're very, very grateful to be able to give a talk at South by Southwest in Austin about a year ago, last March. And Amber's talk just stole the show with her images of fire. It really did. I mean, so horribly destructive, as we know, but also the images are just so striking. But anyway, I'll turn it over to you.
Thanks, Don. Wasn't expecting that. Now I'm off. Let's see, where's this nasty pointer we have? Did that work? Did that work? Yes, there we go. Point down. So first, I want to begin by thanking everybody in this room, all of the PIs and the partners. I think that together we were able to come up with ideas that we would not have otherwise. And right now, I feel like we have great ideas that I wish we could all do over again and just go forward with this. And we'll see how that works out. But thank you to all of you. We put pieces and parts together that I'm not touching anything, that we would not have been able to do otherwise with all of you from distinct different fields. So thank you. And secondly, I'd like to thank the EPA and Sherri, but I've worked with the EPA for well over 20 years, and they're just exceptional. And it's because they want to use the data, the information, and what you were able to provide that enhances anything they have. They want to use data to make decisions better, to make tools better, and it just makes you feel so valued when you have great partners. So thanks to them both. Now if I could get back to my first slide. So I'm a fire person, and I look at fire, patterns of fire, large scale and small scale, and also smoke, and processes. So I run a gambit, but everything is fire and smoke. And coming from the wildfire community, even though we may not want to hear it, I know that we have to increase fire on landscapes if we want to decrease the possibility for the extreme fires that we're seeing, like in California. These fires are devastating for a lifetime, not just a couple years. So it's bad stuff. And even though there is good fire, there is no good smoke on our landscape. And so this is what we're having to deal with, is to think about how do we balance needing to increase fire on our landscapes for ecological reasons to reduce the fuels with the health and air quality. And we don't actually have all the basic fire information to be able to even ask these questions to come up with really good health assessments. So one of the types of fires that's missing is small fires. We know we do a really bad job at looking at small fires, but now we have high and very high resolution data, so we can begin teasing that type of information apart. Okay, point at the right place. Now it's not going to move at all. There we go. So the reason that we can't see small fires is there's a lot of them. The polar orbiters are not overhead when small fires are typically burned, when humans burn. They like to light early in the morning, late in the afternoon, because we know what we're doing. The relative humidity is high, and you don't want the fires to get out of control. We do have geostationary satellites, but the resolution isn't as high, so we're not as good at getting them. And also there's a lot of cloud cover, and the fires are not intense. So there's many reasons we don't do a good job of being able to quantify small fires. And that's not just in the National Fire Emissions Inventory that's put together by the EPA and states, but it's all emissions inventories. So what we'd like to do is show you some work that we've done in order to help improve this. Fires in the Southeast are very important, like you heard before, in terms of area burned. They are equivalent to western wildfires in a normal fire year. It's just that they're under control and you burn all the time, so we don't hear about them because we've been doing it in the Southeast for a long time. And if you look at these two fires, the top row is one fire, the second row is a different set of fires. So on the far left is pre-fire. The second over, where you see the digitized fields, is active fire burning, and that's August 31st. The next day is the 3rd and then the 4th, and both of these you can't see the scars. So not only do they not burn very long, but they disappear really quickly. So you have to catch them by looking at them even daily if you want to quantify these small fires. They're just very complicated. I didn't even touch it, but I was about to. So it's ESP. What we've done is we've taken lots of satellite data. We've taken the commercial data that we get from NASA through a program, and we also have other NASA data and NOAA data and ESA data and inventories, EPA inventories, state inventories, and Federal Forest Service inventories. So we're taking all this information to be able to put things together and tell a story. And I wish I could tell you all the stories, but we don't have time. What I would like to say is that if we look at fire detections, and even in the Flint Hills where there's relatively large small fires, we don't even capture half of them with active fire detections. And if we were to look at MODIS burned area product, we only capture about 65% in the Flint Hills. If you're talking about fields that are smaller, we only capture about 30% and less than 24% of the area burned. It's smaller fields. So looking at one area doesn't quite quantify all areas equally. So if we looked at Iowa, they have a lot of ditch and pile burning, and it turns out that we might be overestimating the fires in Iowa. So you do have to think about the landscapes, whether it's reflective Arizona or where you are, and the type of burning. So this is going to have to be a relationship that's developed one ecosystem at a time, one state at a time. And now with my final slide and my final story is I've taken a lot of satellite data and I've put it together to try to reach towards the truth. And in the top left, we see a horizontal view of aerosol optical depth. And when we looked at it, we said, wow, 2022, it's the worst fire season ever in the Flint Hills. And then if you look at the bottom left, when you start looking at what is burning in New Mexico and Arizona, you can see that most of the smoke is coming from there. So it's not even from the Flint Hills. Then if you move your eyes to the top left, the next thing we did is we looked at the horizontal data in the atmosphere. So we looked at LIDAR data, and you can see that most of the aerosols are not even smoke, they're dust, and they're dust coming from outside the region. And then if you look at the bottom right, you can see that most of the dust and smoke is going overhead, and it is the largest dust year in 2022, the record for Calypso data in that region, so the dust record. And I'm going to turn this over to my colleague, Sherri Hunt, and here she is.
Okay, thanks, Amber. I'm glad you guys are all here. I love scientists. I love that people are spending time working on really hard problems and putting together data in ways that we can develop tools that will help us to come to solutions with those tools. So Amber did a great job of showing you some of the work that she and her team have been doing. EPA really values the work that's come out of HAQAST. And I'm the only one standing up here saying that. Well, Barron said it earlier, but there are lots of people in EPA that value it that are not here today. I'm just representing them. The information that Amber's group produced to show these different fire types has been extremely useful. It's already being used by our emissions inventory team, and working with the EPA regions. The ditch fires also have been extremely helpful, and that's been addressing questions that have been coming to EPA researchers directly from those areas for many, many years, and we just couldn't answer those questions because we didn't have the data. And so that's excellent. Gotcha. I'm just going to say there are lots more projects, Tiger Team projects, that we love and then I'll see if I can do this. But what I also wanted to take a little bit of time on today was to tell you some of the things, the questions that we're thinking about now, because I want to give you ideas for what your next proposals are going to be. So in my imagination, we would have a fire inventory that would be able to tell me all the fires that burn, what kinds of fires they are, what kinds of fuel they burn, and then I could calculate the emissions because I have so many measurements that I could use those emissions. And then I could also understand the transport of the smoke. If we had all that information, we would have solved so many problems. That would really help with other practitioners so that we could give people good guidance on behaviors that would be needed to protect ourselves from fires. And, you know, in addition, we really need a lot of tools that can estimate current smoke exposure. We want to predict near-term exposure. We also, when we think about the fires in Los Angeles, we want to be able to predict what would be the health impact of exposure over multiple time frames. It used to be a wildfire where people got exposed was once in a lifetime thing, but we're seeing now that that is not the case. So we don't even know what the health results of that are because we haven't done those studies yet. So we need the exposure that you guys can help provide for that. And we also want to be able to communicate the risks. The American Lung Association, HEI, they're often communicating risks. EPA is also trying to communicate risks as well. And so and in doing that, we want to determine what are the behaviors that need to be changed in order to reduce your exposure. So that's what some of the figures are there, and I'm all done.
Thank you so much. And to wrap up our talks before we move on to Q&A, I'm going to invite up Yang Liu of Emory University, and we also have Leticia Nogueira of the American Cancer Society. Yang Liu is, I was talking about OG members. You're an OG member. You were a member of HAQAST originally starting in 2011 and have, of course, continued to not only being a foundational member of our HAQAST team, continued your amazing contributions to us over the past 13 years. Also, Yang has worked with us across the health and air quality portfolio for many years, particularly being one of our research experts working with our stakeholders at CDC, because of course he's right there at Emory in Atlanta. So I'll turn it over to you. Oh, Leticia's going to go first? Okay, sorry. Leticia's going to go first.
Oh, geez. And I'll never touch that again. Okay. Hi, I'm Leticia Nogueira, and at the American Cancer Society, I work in the Health Services Research Department, which means we study everything that makes it easier for people to access cancer care and to improve cancer outcomes. And in 2018, I was talking to one of my friends, and she was telling me about the struggles that her mom was going through. And her mom lived in Paradise, California. And at some point during the conversation, she said, what people don't understand is that this is about so much more than the smoke. Because, of course, Paradise, California was where the campfires happened in 2018. So as a good friend that I am, I started thinking about work. How can you imagine being a cancer patient and going through this? The smoke, the evacuation orders, the water and the soil being contaminated, everything inside and outside of your house, if you still have a house. And so I started looking for ways that we could measure exposure to wildfires. And at the time, most of what I was finding in the literature was using air quality monitors, which we talked about a lot today, are super important, but we will only measure smoke and are mainly in metropolitan areas, while these fires are more likely to happen in suburban areas. So that was not going to work. And then I read an article about satellites.
Thanks, Leticia. Like John said, I'm one of those lifers with the HAQAST program. It's such a pleasure and privilege to be part of this community. So, yikes, what did I do? There we go. When Leticia talked to me, it was like, yeah, why don't we study wildfires, right? Wildfires is great example of multiple factors affecting human health. And fires occur mostly in unmonitored remote regions. So relying on the regulatory network would greatly underestimate its impact. And it requires a orbital platform to give you a more comprehensive picture. And being from the ACS, Leticia, of course, takes the study population of cancer patients. So I thought about the exposure estimates. Why don't we just go with the NASA firms, right? You have all the thermal anomalies data, good coverage nationwide, and let's see how fire exposure affects cancer patients' survival. It's a different angle, and we found that wildfire exposure was associated with worse overall survival following a non-small cell lung cancer surgery. And I think Leticia can do a much better job explaining that two angry curves.
Mainly, we found that patients who were exposed to a wildfire up to 6 months after they were discharged from the hospital following lung cancer surgery. So you can imagine you have mobility issues and you're taking medicine, and of course you're recovering from lung cancer surgery, and you're exposed to a wildfire. That spelled out bad news. No surprise, but somehow had never been reported in the literature before, and that's the survival curve in the center just showing the exposed patients had worse survival.
Yeah, to pay attention to the vertical gap between the exposed curve and the unexposed curve. Imagine you are a typical 50-year-old, successfully completed your cancer surgery, and you're resting at home. If you have not been exposed to a fire event, your survival rate, a 5-year survival rate, is about 70%. Now, unfortunately, if you have been exposed to wildfire, your chance of survival dropped by 50%. Right, so that's how you interpret the difference between the two curves. So we got a lot of media coverage after this. I don't know how many times we have been interviewed by journalists. And then people ask a question. It's not just the Western US. People got exposed to fires everywhere. And so we went ahead to kind of analyze that. Now, the map shows a long-term change in person days of fire exposure, okay? So our approach has this people-centered idea. And we look at that between 2004 and 2023, most of the 80,000 census tracts in continental US experienced an increase in person days. Look at the color scale is actually log transformed. Okay, most of them have experienced increases in person day exposure between this 20-year time span, with the southern region experiencing the most dramatic increases. If we divide the entire nation into 4 large regions, the south, the green region, accounted for 64% of the overall population exposure to fires. It's a little bit counterintuitive because we don't hear it. We don't see it on TV. We don't read it in social media. And the time series also confirms the trend that the South is experiencing the most rapid increase in fire exposure.
So after those 2 studies, I was hooked, right? Like, this is amazing. And I started bothering the HAQAST team pretty much every day. Is this satelliteable? Is that satelliteable? Can we measure this? Because there were so many environmental hazards we had been wanting to study, but there was no way of measuring the exposure. For example, power outages. We all hate power outages, but they're especially bad if you're a healthcare facility. Imagine trying to do surgery, keep the medicine refrigerator, run your oxygen tanks and your dialysis machine if there is no power. So if you're a healthcare facility, you cannot be without power, which is why if you want to get paid by CMS, the Centers for Medicare and Medicaid Services, you have to have an emergency power source. And until recently, the only type of emergency power source that CMS accepted was diesel-powered generators. Now, you can imagine if you have a prolonged power outage, such as what happened in the aftermath of Hurricane Maria in Puerto Rico, and you're running these diesel power generators there at the center for days on end, you start getting complaints from the community, right? There is no air quality, there's air pollution, there is noise pollution. And recently, CMS expanded the types of emergency power generators that are accepted. So as our technology advances and we have more options, how do we choose? Can we help healthcare facilities make informed decisions when they're choosing the type of emergency power that they're going to have? We talked a lot about measuring air quality, monitors, and then satellite, but can we expand this to satellite data to measure power outages or the association between power outages and air quality? Is this satelliteable? Oh no, I'm doing the thing, wait. Another point of concern. So cancer patients have to go to cancer centers to receive treatment. I don't know if you've ever been to the doctor, but sometimes there's a wait when you go to the doctor, and that is a problem because when you're a cancer patient, you're at the doctor a lot. And when you're waiting, there's this, or when you're visiting these healthcare centers a lot, then there is an increased risk of exposure to extreme temperatures, which is especially concerning for cancer patients because a lot of chemotherapy drugs make it harder for us to control our body temperature. So is there an association between some characteristics of the built environment that would help protect these patients, that would decrease the risk of exposure to these extreme temperatures? And here we're looking, for example, at the vegetation around the hospital. So this is just two of the thousands of questions that I've been asking the HAQAST team, because really satellite data has revolutionized the type of research that we can do at the American Cancer Society, and it's already having an impact, real life impact on cancer patients' lives. The Commission on Cancer is now having monthly meetings about how to better prepare to wildfires because of our study, right? And so I just really wanted to thank you for this opportunity to incorporate this data, which has really transformed the work that we do, and it's helping a lot of people right now. Thank you.
Thanks, Leticia. And, you know, in conclusion, after working with Leticia for 4 years, I feel like, is this just one of her 300 smart ideas? Is this even possible? So I took like 3 months surfing the internet and then another 9 months to figure out the data. And then we have like a week to analyze the data. And it seems to make sense, right? And then this thing was like, is that even possible that this kind of work, right? This is totally out of the box thinking. And then again, going through the process, like, yeah, satellite can give you a lot of additional information, especially resolved information. That keeps this partnership going, right? And we expect to work together for the rest of our time. Thank you so much.
Thank you all so much. And so ask all of our speakers for this session to come up and join us on stage. Stairs both right and left. And Jenny will be our roving reporter. So any questions we have for our panel today? There's one over here.
Hi, I'm Corinne. I'm a PhD student at the University of Delaware in geography, and I have a question about, I've seen the amazing potential in projects that you've done with interpolating satellite data, but have you seen sort of the reverse where agencies or researchers connected to them are kind of misusing this data? And just for context, in Pennsylvania, there was a cancer cluster study where they used a finer spatial resolution than one of these data sets said you were supposed to use to show that people were not being exposed to very much PM 2.5 in an area where there's a suspected cancer cluster, and they found none. Thank you.
Well, maybe I'll start to say that that's a question that we get quite a lot. Like if we're trying to get more organizations to use
satellite data and be aware of satellite data, isn't there a risk that someone will misuse the data or use it? And I'm not familiar with that situation, so I'm not commenting on that, but isn't there a risk that someone will not use the data correctly? And I guess I would say there absolutely is that risk. Anytime you put information out available to the public, if it is being used at all, it will sometimes be used as expected, sometimes better than expected, and sometimes worse than expected. And I think, but if nobody's using the data at all, to me that's a big waste of the billions of dollars of data capability. So, I think that we're doing our best to provide clear guidance and answer questions, clarify the uncertainties, have a lot of, technical guidance documents. I mean, we are leaning in part, on all the extremely careful science that's been done that's in the peer-reviewed literature. So I think that, there will sometimes be, bad stories, but I think that, it's the best story is to say, well, how could it be used and where are the bright spots? And then also, what's the right pathway to be empowering people to use it and understand what the data can do and what they can't do.
I wanted to add on about fire a little bit, and actually a lot of NASA satellite data. It seems like we're so much better at that. It did never seem to be nefarious. It was an accidental misuse of the data, not understanding it because it's complicated. So what we've done is we have RSAT classes, we have training, we get better at explaining it. We've always had a long list of what's right and wrong, but that's hard to read. So we try to go to the quick one-pagers now and say, warning this or that. So I think we're getting better at communicating it and knowing that it is complicated. So that's how we've dealt with that. But yeah, it's a problem, but I haven't seen nefarious.
I'm just going to add one more thing. I spend a lot of time hopping back and forth between the measurement world and the health research world, and I'm always trying to ask people, researchers, to spend more time thinking about and collaborating with. So one thing that I love about HAQAST is, working closely with people who have the health background, who really understand that, because I think it's really hard, as Amber said, to understand all the complexities of the data. And so even in one conversation, if you try to understand it, there probably are some things you're missing. And so building those relationships, I think, is extremely important.
I just wanted to build on that and say that the first time I heard about the satellite data, I tried to access it, and I dropped the server at the American Cancer Society, and IT got really mad at me, and it wasn't even the right data. So to your point about HAQAST being a bridge, instead, what I learned from this experience too is that we all have our expertise. We're all learning all the time, but when we work together, that's really where the power is. This is being a bridge between the satellite world and the air quality world and the cancer world. Like bringing everybody together is really the way to do it.
Hi, Joel Dreesen, Maryland Department of Environment. And as a preface, I'm also an air quality forecaster, so I'm coming at this question from that angle. There's an amazing amount of knowledge coming at air quality from a health perspective here. So I want to ask, is the current form of the PM 2.5 standard, the 24-hour average, correct for health protection?
Well, correct is a loaded word, right? All I can say is that the American Lung Association and many of our health partners advocated for a stricter 24-hour standard and have for the last several rounds of review, and it didn't happen. And we're all behind the change that was made, and we want to see it implemented in the annual standard, but we will continue to advocate for more protection from 24-hour peaks in PM 2.5, especially in vulnerable communities.
I think one other thing just to add, and it came up in one of the talks, was also the changing nature of episodic exposures, because even 5-10 years ago, we weren't seeing as many wildfire episodes or extreme heat episodes that result in high ozone levels. So at some level, like as the health researchers, we need to be thinking about what those peaks mean and what those short episodes mean. I think, Sherri, you brought up that question as well. And then build on that evidence to decide how the reduction in exposure information or personal intervention information is also communicated. So that's just one thing that I think we need a little bit more data on to try and make better decisions, especially with these changing exposure patterns.
I represent the Office of Research and Development, and that's a policy question. Yeah, I feel like this is a more detailed, nuanced question that I'm happy to talk with you at the break.
Here's Jenny. We have another question.
Randall,
oh, I'm sorry, Randall.
No worries. I can view that as a research question. So there's opportunities then to investigate what is the shape of the exposure response function at these low concentrations. That's something that the HEI has been promoting that question of in EPA. What are the chemical components that may be most harmful for PM 2.5? Could we identify that and maybe develop strategies to reduce those chemical components? Or what are the sources that contribute to ambient PM 2.5? Are some more harmful than others? And I think that these are exciting opportunities that we can continue to advance our understanding of PM 2.5 and maybe move towards even more effective solutions or regulations.
This is Alberto Mestas from the University of Texas in San Antonio. I really enjoy the presentations. I'm a remote sensing person, but getting kind of new in this field. I wanted to know, how do I sell my students the outlook in terms of jobs, in terms of professions for the next 10 years? If you can give me a sense of, what would be the health of this type of applied satellite in health and so on.
I can give it a try because I teach remote sensing in the School of Public Health. And that's a question I answer in my class. My way to answer that question is I show people a classical curve of the maturity of a discipline. And if you think about remote sensing as a discipline, it's still a very, very young field, right? We're not talking about chemistry here. At the current stage, remote sensing applications and remote sensing technology is in this rapidly evolving phase. And we have new ideas, new studies popping up all the time. So basically, we're teaching information instead of established knowledge or wisdom. For students, it's a very exciting period to enter such a dynamic and growing field because literally everybody can make a name for themselves as long as they work hard enough and they're smart enough. And that's how I sell remote sensing to my students.
So with remote sensing, I am with NASA, and I've worked with a lot of NASA data. NASA seems to be on the cutting edge of any kind of satellite science and data and launching. So we go where no man has gone before. So we're there. But when we come up with something good, other agencies pick it up. We're no longer doing Landsat. Well, we help. And then it goes to the USGS. And VIIRS, active fire detection, has been taken up by NOAA, and TEMPO is going to go on as well by NOAA. So and there's ESA. So there's no longer one satellite organization. There's an international constellation of satellites that we're all allowed to use, and we try to share. And we're working towards this. So we have more satellites now than we've ever had before. We share data, we have access to data. It's not perfect, but it seems to be getting better. And satellite data is something you you can work for just about any organization, and satellite data can be useful. And we also want to share how to use it easily and try to make these products. So I think it's we're at the beginning, I think, and it's a really exciting time to be a young person looking at satellite data.
And we have a question from online from a young person using satellite data. Kamlika asks, it is great that we're looking at air pollution problems in low and middle income countries, but do you also see avenues for exploring health impacts of people who live around industrial areas in both developed and developing countries? Getting at the theme of this session, a lot of these times these people are exposed to very high levels of particulate matter, but a lot of the places still remain unmonitored.
That's a great question, and I think, one of the things we found to be so exciting about satellite data for health applications is that you have unmonitored areas across scales. You have wide states that may have no monitor, and you have densely populated neighborhoods that may not have a monitor. And those areas have very different air quality issues. They have different sources. They have different health impacts. And so, I think that the work of the team has really spanned a wide range of different environments, from offshore emissions to warehouses, to cities, to rural communities, including in the U.S. and other countries. And I think, one thing about doing work in the U.S. is that we have so much data. In addition to serving the United States as part of the NASA mission, it's also just a good laboratory to be analyzing, validating, cross-checking, et cetera, so that some of the insights that come from satellite applications in the United States can be transferable to other regions. But I think the short answer to the question is absolutely, and there's been a lot of work out of this team and others on unmonitored areas across scales.
And I'm afraid that's going to have to be our last question and answer for this panel. So let's all give another round of applause to our panel.